Scientists conducting a retrospective study in Taiwan using an insurance system found that a person with obsessive-compulsive disorder (OCD) had a fourfold higher potential of developing Alzheimer's than someone without OCD. They found that men with OCD were more likely to develop Alzheimer's disease whilst women were more likely to develop vascular dementia. Those with OCD were found to develop dementia 6 years before those who didn't have it. It is important to remember, however, that this was a retrospective study, and far more long-term studies need to be done before a definitive conclusion can be reached. This may well cause you to ask, what is OCD? Obsessive-compulsive disorder, or OCD for short, affects as many as 12 in every 1,000 people according to OCD UK. It is a common mental health condition with 3 main elements. These 3 elements are obsessions, emotions and compulsions. An anxiety pandemic has hit the nation's youth, says mind coach. Obsessions are unwanted, intrusive and distressing thoughts, images and urges that enter the person's mind. This obsession causes an emotion, most often feelings of intense anxiety or distress. This emotion can then create a compulsion, such as repetitive behaviors or acts that a person with OCD feels they must perform. The problem is that whilst this compulsion relieves the emotion, the obsession soon returns and the cycle starts again. COVID-19, young people found lockdown harder, says Charity Insight. Omicron COVID variant, we are kidding ourselves, Cambridge virologist on the disease. Insight. High cholesterol, new vaccine targets high levels to reduce heart disease risk. Study, Insight. OCD can have a significant impact on the lives of people who have it, so it's important to seek help and support those who have it. There are 2 main ways to get help. They are referring yourself to a psychological therapies service or to see your GP, who can then refer you. You can also phone the Samaritans, and there are multiple helplines to guide you through what can be a difficult experience. You can't change if you have OCD or not, but there are factors you can control that can help reduce your chances of developing dementia. As with the symptoms, there is no one cause for all types of dementia and no complete scientific understanding that would facilitate the development of preventative treatments. Nevertheless, there are things we can all do to reduce our risk. The charity, Race Against Dementia, has outlined 12 risk factors that can help to reduce the likelihood of developing it in mid or later life. They say that if these are all mitigated worldwide, it could reduce future cases of dementia by 40%. The first, and only early life factor, is education. According to the charity, higher and longer-lasting education is proven to improve cognitive performance. In midlife, hearing loss, hypertension, high blood pressure, obesity and a high alcohol intake are all cited as factors we can mitigate against. Furthermore, the charity recommends that living in an area with high levels of air pollution, such as large cities, or an area where you are socially isolated will increase your risk. Despite these risk factors, the positive message to get across is that these are all factors that, for the most part, are in your control, and that, even if you're in midlife, you still have time to change and adapt.